Have chronic hip pain that was diagnosed as bursitis that never seems to go away. Tried massage, chiropractic, physical therapy, anti inflammatory medications, and injections with little to no long lasting pain relief. Then this video is for you. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long lasting pain relief. All right, let's get right into the video. What does bursitis even mean? A lot of times when I get a diagnosis of bursitis, it's just code word for they really have no clue as to what is going on. But the definition I found was bursa are small fluid sacs that reduce friction between moving parts in your body's joints. Hip bursitis is inflammation or irritation to one or more of the bursa in your hip. I always want to be able to answer the question, especially when I'm dealing with people that have been in chronic pain and haven't got any real answers of why is it happening in the first place? Basically, it just means that the area is inflamed, but inflammation happens for a reason and it isn't often the main cause of the problem. So, why does this happen in the first place? The first thing that happens is this stuff known as adhesion, also known as scar tissue, builds up inside of all the muscles. So basically, what happens is over time with bad postures, overwork, not moving enough, maybe doing too much, the muscles get constantly stretched and contracted. They don't get enough blood flow. They don't get enough oxygen, and that adhesion starts to pour inside the muscle, also known as scar tissue. And it makes it really hard for everything to be able to stretch and move as it's supposed to. Then eventually, what happens is that adhesion gets bigger and bigger and eventually gets stuck to the nerves in and around the hip and causes some big problems. So when you have the adhesion and then the nerve entrapment builds up as well, everything around there really tightens up. So whenever you're doing something, the force has to go somewhere and it ends up going to the joint in the cartilage in the hip itself and creates this stuff called degeneration where things just kind of get older before their time. That's where the inflammation starts to set in and that's where the bursitis comes from. So the bursitis is happening because all of those other things aren't working correctly. So, why doesn't massage actually help it? Because when you're actually treating that area, it needs precise treatment, especially when the nerves are getting stuck. And a lot of times with massage, they get way too much depth and not enough tension. And usually, what happens is they just compress the tissue and it temporarily feels better, but it doesn't actually break it down. Now, for chiropractic, what they're really doing is they're only addressing the bones, not the soft tissue. So I always say, hey, if the bones keep going out of place, the things that hold the bones in place or are the soft tissue. It's kind of like the brick goes out of place and the mortar is the soft tissue and everything in there. So fix the soft tissue and the bone won't go out of place. That's why people only get temporary results with chiro because it's not addressing the real cause, which is the underlying adhesion. And lastly, just physical therapy. The muscles just aren't healthy enough to do the exercise yet. Like I said, when I have all the adhesion in the muscles and around the nerves, the muscles are weaker and less flexible. And a lot of people think, oh, I just need to stretch them and strengthen them. No, you got to get that stuff out of there. It's almost like trying to fix a cavity with brushing and flossing. It needs a special type of treatment. So, why do medications and injections temporarily help, but the pain comes back worse? Bursitis is the effect, not the cause. I always say it's the smoke, not the fire. And treatments that get rid of pain but don't improve function are actually dangerous. I always say the pain is basically your body's like check engine light that came on to tell you that there is a problem and something to pay attention to. And a lot of times when people are doing like injections or pain medications, they block that pain but don't actually fix anything. And even worse, they make the joint and tendon breakdown a lot worse over time. And even worse is the doctors actually know that, but then they get to do an expensive surgery down the back and the back end that actually can make your problem a lot worse. So, how do our providers evaluate and treat the problem for long lasting pain relief? First, it starts with a thorough and detailed functional evaluation to know exactly where all the adhesion and nerve entrapments are. Then we do very precise and focused treatment to the adhesion and the nerve entrapments. This is going to help the muscle gain more movement and flexibility. Once the range of motion is actually restored, we build strength back up with some focused corrective exercises. This is something I think like traditional physical therapy is really good for once the tissue gets healthy to build the strength back up. We also do some custom supplements and some dietary advice and even some lifestyle modifications to really help the patient reduce that inflammation. And then once we get it in a good place, we do have people come in for follow-up treatments anywhere from 4 to 6 weeks just to keep the tissue healthy. I kind of say it's like getting a cleaning of your teeth before it becomes a cavity again. Because a lot of times what happens with life and everything like that, people are going to continue to build up that adhesion. And if we get on it early before it becomes bad again, we can prevent those cavities down the road. So that's all I got in the video. If you want to find out more if a peak method trained provider can help you get rid of that never ending pain from hip bursitis and on the path to functioning at the highest level possible, then click the link in our profile to learn more and see if you qualify for a no charge injury consultation. Thanks for watching, and I'll see you on the next one. Bye.